deeply, more at the floating level. I'm sorry. And just a second. In sinking pulse, you needle more deeply. So this is where, this is important to notice. It's simple, but this gives you these 6 pulse, this is the pulse quality aspect. We do the 6-position pulse, which we'll work on later on this weekend, and the pulse quality aspect. These pulse quality are really important because they let you know what kind of technique you're going to be doing. And they also tell you to some extent, I guess, what kind of, needle you're going to be doing, but we won't go into that right now. But basically, that's what the pulse quality gives you some range of what you're going to be doing with the thing. What was your question?
Well, the fast technique with a fast pulse, that's for dispersion as well as tonification. I mean, you have that concept.
Yeah, I think so. But that's just one dimension. There may be other dimensions to the technique, like you may have a really deficient fast pulse, so you're doing tonification, but you're not staying on the point so long. Right. That is correct.
Would that also go for your metal selection for your needling? So if that's the case, fast and deficient, you would not want to choose a gold needle, for example, because you have to be very much faster, correct?
Yeah, I'm not sure about
because I've heard that Goldie
is what?
Is more active, that she comes faster even.
I don't know enough about gold to make a comment on that. I'm not sure. Yeah. Okay, so let's finish this. Okay, well that's basically it. Is that for basic information? Are you clear on Fujitsu? Well,
did you say that
you all got to do it once last time with him, didn't you? Or he just did it on you? He showed it on you. Okay.
So, did you say you removed the needle quickly?
Quickly with Fujitsu.
I'm confused. One of the techniques that Takahashi did was taking out the needle very slowly. What's that?
He was doing some sort of dispersion technique. He was either doing Genjitsu, which we're going to do now, or he was doing one of the excess within deficiency techniques, Koken-Jin. Those 4 techniques are slower withdrawal in general. Fujitsu is a quick withdrawal.
So this is used mainly like for EPI?
Yes.
And you could use anywhere from 1 non-ingredient to several of these?
You would listen to you would read the pulse each time you did the technique. Oftentimes, someone has a real bad acute cold. You might end up doing 3, 4, 5 yang channels. You may find hardness throughout. You still always do the whole technique first, though. Here, I mean, you'll find the primary show. Do the primary show. Do the secondary show, and then hopefully that Fujitsu will even start to soften a little bit and rise, and you'll see really clearly. And you'll hear more about that in the coming workshops. But one of the basic principles of this whole following Nanjing 69 with Toyohari is that you tonify first and disperse afterwards. And their theory is that if you tonify the yin level, if you tonify the primary yin deficiency, then the jaki, the bad chi, will tend to rise to the surface. I mean, if you're a real genius, you just tonify the yin deficiency and all the jaki goes away. There's a couple teachers that can do that. But for most of us, if you do a fairly good job of tonifying the primary show and the secondary show, then it will rise and it'll show as hardness in the large intestine and the stomach and the triple burner and then you can do the yang aspect and pull out the jaki, depending on if it's a true excess kind of jaki, a fu or gen, or if it's a mixed Koken-Jin. So, but you'll start to learn that. But yeah, so anyway, you do that first, and then you do the yang channels. That's how you'll do it. Yes.
I had a question about the manipulation.
Yes.
So you go in there and you kind of hook the chi, and then you do the up-down thing?
Yeah.
Okay.
Yeah.
But meanwhile, it stays hooked, or as you
It
work?
should stay hooked. Yeah, you're not going. It's not a with Fujitsu. It's not a big thing. It's maybe you're going up and down. There's actual movement, but you're probably not going up and down more than a millimeter. Yeah, you're not doing a big swing. You're not taking that needle off. Yeah, you're kind of gathered. The chi gathers, and then you come up and down, and you've got good control of it. I mean, you've got a real firm oshide. So that needle's hooked into the chi there, and you're indenting the skin 1, 2, 3 millimeters, and you're kind of going up and down, 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 up and down. So you're not letting, when you come up, you're not losing connection with that hook.
Right.
But then you kind of you come up, and then you go into it, and your awareness is at the tip of the needle, feeling for at a certain point. You come down, and all of a sudden, and let's go a little, let's go some, and then you finish. Then you go, ooh. Well, you might want, let's go some. You make sure you're protecting the normal chi in some fashion, and then.
And the angle is not any more perpendicular, it's the same.
45 degrees against the flow. Against the flow. It's a dispersion technique.
And you're visualizing pulling that chi out?
You're basically popping a balloon, popping the balloon and keeping the normal chi in. Kind of popping that acute pathogenic chi, so it has an exit, and holding the normal chi in. So you just, and that's the basic visualization. Yeah, the sense of what you're trying to do.
Yeah, I've kind of visualized it like it's like this massive yarn or something. And I don't know if that's the right.
I'm not sure.
Anyway, whatever.
We can talk about it. I'm not sure. Massive yarn.
Well, just the whole hooking idea that you're like moving the needle around.
Yeah, a massive yarn, people or a spider web, like like the tip of the needle's getting hooked into some sticky area or something. Yeah, I mean sounds. But then once that's hooked into that sticky area, then with this technique for chi level excess, this is what you want to do to kind of allow it to get out. Okay, now let's compare it with Genjutsu. I'll just read here. Description: relates to chronic disease at the blood level. So diseases such as arteriosclerosis, diabetes, rheumatism, complaints of stiffness, pain from overuse can show this pulse quality. So you can see, this is for these chronic sorts of diseases that we actually run into. If you've ever had elderly people in your practice, with these arteriosclerosis and diabetes, and they're clearly really deficient on many levels, but they have these just hard, booming pulses. That's a Genjutsu pulse. So just because we're talking about one aspect of the pulse, we don't want to get too fancy here, but often beneath these Genjutsu pulses, they really are very, very severe deficiency. But for beginning purposes, Takahashi would say, don't worry about it. We're not going to worry about that too much about figuring out the. Anyway, go ahead.
Would AIDS be a type of this type of pulse?
I think it could be.
Yeah.
Probably in the later stages, especially. In the earlier stages, it might be more of a Fujitsu pulse. But
just because I notice a lot of AIDS patients have that kind of similar excessive kind of pounding.
yeah, you could ask. Dan's teaching the 6th week, and you can ask him that he's treated a lot of AIDS patients, and he's done that after he was studying Toyohari.
Okay.
I had very few in my practice.
Okay.
So it's excess evil blood, repletion of evil chi at the blood level. So the pulse quality, it results from deeper blood level changes. It's a more yin pulse, deeper sinking, difficult to change. I'm sure you run into these pulses. It's a much deeper pulse than the Fujitsu pulse. It's like you feel down in there, and it's just kind of hard and pulsing at the deep level. And that's what we're talking about here, is a Genjutsu pulse. It's usually strong, wiry, pounding, like a hypertonic pulse, like a real strong, wiry liver chi kind of pulse, but not just wiry, kind of hard, hard too.
So, can you talk a little bit, delineate between that fine line between Ken technique and going into Genjutsu? You've got the wiriness, but there's...
Okay, I don't want to do too much of that. I just wanted to talk about Ken and Ko, just so you knew they existed. Marty's teaching that next time. Let's just, since people haven't been exposed to that, I think if I start trying to do the whole thing, it's gonna, I'm afraid that I'm gonna lose focus here. I just want to get out a body of information here.
What's it say just to the left of that pulse quality?
Watch out for tension with these techniques, meaning it's easy to get too tense doing them. It's easy to get too tense doing any techniques, but
You mean
because
tension in your own
tension
self?
in your own self, because you are holding, with these techniques, it's a much more, the whole technique is more, much more zen. I mean, you're waiting for arrival, you go down, you wait for arrival of chi, you gently gather, and you're soft, everything is round. With these techniques, it's more, there's a little bit more, you're kind of going up and down, and you have to, so that means the Sashide hand is much more involved on a certain level. The Sashide with Ho technique, feathers it down and then kind of keeps things stable, as you're just kind of there's more like a dynamic tension between the Oshide hand and the Sashide hand with Ho technique, see, as the chi gathers and you're going through it. But here you have to be a little bit tighter because you run a really good control of the lifting and thrusting. And so it's easy to kind of start going, and when you do that, then you've lost it.
So it's really more up and down, not an arc, right?
It's up and down. Yeah, you see some, I've
Like
seen
I think the
teachers.
kata,
Yeah, they're playing with that. Just worry about up and down at this point.
okay.
They've got the techniques down so much that they know how to maybe do little flourishes to really hook it and draw it out better. I wouldn't start playing with that too early. Yes.
Chris, is this the type of pulse, a lot of adult asthma apply this with that really hard pounding? They're on prednisone.
On prednisone.
Yeah,
With
yeah.
prednisone and really heavy drugs, I think you can get a Genjutsu pulse, yeah. I think those kind of drugs can really make that kind, if they already have a tendency towards that kind of pulse, can make it worse. Yeah, I've seen a lot of people on prednisone, and they just have these horrendous pulses that are really hard to change until they get off of it. And you just kind of have to manage them, and hopefully their doctor are willing to aim towards reducing the dose, because it's like I don't know. Most people I've seen had bad experiences with prednisone. I've only seen a few people where I felt like it really helped them a lot. Most people, it's hurt their health quite a bit. Where am I here? Okay, so pulse quality, okay. Pulse strong wire pounding. So primer used on the liver channel. So you'll often be using like liver 3 on the Sokoku. Sokoku means control cycle. So we'll be using, Toyohari tends to do this with the liver. They tend to use Genjutsu on the liver channel. That's almost vast majority of time. And then they also use it, obviously, on the yang channels. And then occasionally they do the longer spleen channel. But mostly liver channel and yang channels is where this technique is done. You use stainless steel. You don't use silver when it's a really hard Genjutsu pulse. I suppose if you're really good, you could get away with 2 or 3 silver and you know, really have perfect technique and do your stuff, but you need something a little bit more firm, a little bit more body to it, to really, you know, to play with that real hardness of that pulse.
Is it common to have to repeat that technique on the yawn equivalent on the prepared liver gallbladder?
I'm not sure the question.
Well, often, yes, Genjutsu is used on liver 3. Would it often be used on gallbladder 37? Is that
Yeah.
often the pattern?
Yeah, after you do the liver, after you do it at the liver level, then you would be checking, you know, after you finish all the in-level treatment, you would be checking the yang level and see what's happening at that level. And if there was a Genjutsu pulse, you would do it. And there probably will be. And basically, you're looking for small changes with this pulse. This kind of pulse is not going to change overnight. You try to get it, you know, you try to get it, do a good job tonifying, get it to rise, and pull it out some, and calm it down, slow it down if it's fast. And if you get some change, that's good, and then you just keep treating it over time.
So you just take what you get?
You take, yeah, and I mean, people that have this pulse, they're not going to get well instantaneously. You're going to have very few one treatment miracles. Yes?
So when it says use on a liver channel for control cycle, you talk about a spleen show?
Yeah, it might be a spleen show or a lung show.
Donna's gongs.
No way.
Yeah, we're not a gong when we're be gong.
It's a nice one.
That's nice. Very cool.
Okay.
Here, you know, it's
Okay, see what I'm saying? Technique, hold needle handle tightly. Needle angle 45 degrees against, again, it's a dispersion technique against the flow. Open oshidi, put needle in quickly, can advance to 2 or 3 millimeters. Get a good, I have here, get a good resistance. So you advance it in, you try to get a good, hook into the chi. And then use slow. Now this is Genjutsu, we're going slow instead of fast. Fujitsu we did was a faster. Genjutsu, oops, sorry, is, so you find the point, you form the oshide, you advance it relatively quickly still, 2 or 3 millimeters into the channel. With this technique, often they insert even. I mean, they might go 4 or 5 millimeters. I mean, you might need to go really deep in order to hook that hardness. And then you start up again, just like Fu, but it's a slow kind of up, down. What is it called? Zuka Zuka. It's not going to sing. Up, down. So you're feeling for it. And then eventually, at a certain point, you'll feel things kind of release. Where it's hooked into the chi, you'll feel a release around the tip of the needle and around your fingers. And then at that point, when it starts to release, you slowly pull the needle out, very slowly, and you're pushing down really firmly to the point. And then you hold it down for maybe another breath or so and then come off.
What would be the longest one would have to hang out to hook that jockey?
I've seen it.
It needs to be a long
I've seen it.
technique, but-
Teachers do this one longer, 30 seconds, 60 seconds, but in general, they still do this one, you know, pretty quick because they're able to get it so quick, much quicker than we'll be able to get it. So we might hang out for 30 seconds, 60 seconds, because our technique, you know, it takes us more time to adjust, more time to actually feel the chi, and we're not sure if we have it, and we make a little adjustment, and finally we feel a little hook there, a better hook, and then finally we keep on doing it, finally let's go a little bit, you know, maybe we get a 30% release where they got a 100% release or something. So we will do it. The reality, I think, is that you will do it slower for a while until you kind of, you know, really get in the form and are able to get that, go right down to the chi level pretty quickly. If you do it that way, it might only be 5, 10, 15, 20 seconds. I mean, this does not have to be a long technique.
The writing has heaviness about something you are pulling out.
I don't know what that means. Heaviness about stuff you are pulling out.
Okay.
I don't know what that
And
means.
then over on the other, pull out with
Same angle.
angle.
Pull out, like you're pulling out a heavy weight.
Uh-huh.
How about how tightly you hold the needle with the difference between food and gin? You hold them both fairly tightly?
You hold them both relatively tightly. I think Gin is even tighter because you're really working it. You're really working that slowness with the Genjutsu. And you really have to slowly have a lot of control, like up, down. Whereas the Fujitsu, you want to be firm, clearly firmer than Ho, but it's like boom, boom, boom. You just want to be kind of firm but stable. But I think it's even tighter. Again, it's like you're really working it. So you have it's a little bit tighter, I think, in general. But again, it's tight within relaxation. So.
Chris, when you pull the needle out, it says retain downward pressure for one breath.
Is that what?
After you pull it
After you
out?
pulled it out, yeah. After you come out.
And you drop it, then you still.
Yeah, it's like, well, whenever. I mean, approximately, just you pull it out and you push down, you just hold it for a few seconds, one breath, and you let it off.
Okay,
So,
that
yeah,
my question was, you drop the needle before you release.
I don't know. No one's ever talked about that. All I'm saying is, I don't think it's so important. I think they're just wanting you to stay on a little bit as you come off it, that somehow it accentuates the consciousness of the technique or the pulling out. It just helps a little bit more excess chi come out, is my sense. Right. Yes.
But you wouldn't, that wouldn't be the only treatment you would give, right?
No, you would do Ho technique. You would do tonification before this in most cases.
You would do before qualification?
Yeah,
before?
you would try to establish the primary deficiency and treat the primary and secondary deficiency. You know, often though, but like I said here, what will happen is you'll find this with spleen and lung deficiencies a lot, and then liver is the secondary excess. You'll find a spleen deficiency, liver excess, or a lung deficiency, liver excess. Those are the most common scenarios that and so at that point, once you've done, you know, like say it's a lung deficiency, you do lung 9, spleen 3, and then you'll go to liver 3, the liver excess, and you got this harder than hell pulse, and you'll do Genjutsu on liver 3. And then you'll go to the yang level. So you do start Genjutsu at the yin level when you're doing that liver. Okay. I think that's enough talking.
Choice of number 3, I thought we were doing this at the low points when we were doing a draining technique. I don't know where I got that.
On the yang channels.
On the yang channel.
Yeah, what you'll see, again, getting ahead of ourselves a little bit, but I don't want to get too scattered with little bits of information here, but oftentimes you choose the source point on the yin channel for the secondary show. So say you have a lung deficiency, you do lung 9, spleen 3, and then you do the source point for the control cycle. See, you know, or like spleen 3, pericardium 7 for spleen deficiency. You do kidney 3, the source point for the secondary. So they choose source points. The low points are chosen. The low points are chosen on the yang channels. That's the basic. That's what you look for first. So you can do other points too if you feel like they're more the main, you know, more likely. You can do it by sense of touch too, but by cookbook you immediately go to the low point. That's where they recommend you go first. Yes.
What's the rationale and the source point for the control of the yin?
I don't know what the rationale is. Source points are good points to treat in general.
Great.
That's all. It may have said it, maybe just that maybe something I should know that I don't know, but I'm not sure. I don't remember right offhand anybody saying. Okay, let's go to lunch. Are important. Having the copper zinc disc are important if you're planning on doing 8 extra channel treatment at all.
How many steps?
As many as you want. I like to have lots. But I mean, most of the time with the way they're doing it these days, they're doing it simply. I mean, they'll do just one channel. Sometimes they'll do 2. Hardly ever 3 at a time. So you might do like pericardium 6, spleen 4, and bladder 62, small intestine 3. You might do 2 sets of disc at once on a patient, but mostly only 1 set the vast majority of the time. So it depends on if you want to have an extra set for, you know, a couple sets in each. If you have more than 1 room, it depends if you want to have a couple sets at home. I mean, and you might, I tend to lose them, so, and like I was telling Sachiko, I always lose the copper. I go into one room and there's 2 zinc and 1 copper. So I don't know how I do it. So,
Brown carpet?
maybe. So, well, you know, you have them on tape and you maybe take it off the person and then you're getting ready and you toss it over on your table where your needles are. Some of them, maybe it'll fall in the garbage can or fall on the floor and get stuck on a shoe. Who knows what happened? I mean, I'm pretty sloppy that way, so maybe other people won't have that problem. Okay, now what I want to do, so let's look at the schedule here. So I'm a little bit behind, but we've got plenty of time this weekend because the Kike can be essentially done in a half a day, and we'll see what happens tomorrow. I think what I want to do here is set up a bunch of tables in the other room, and I want to do point location. I want to, let's just kind of, since we just ate lunch, let's just kind of find liver 8 and kidney 10 on each other for a little while, and then stay in that room and practice gen and fu on each other. And let's do it at the table, so rather than sitting at the desk, we can kind of work on how we'll actually be doing it in clinic a little bit. I mean, I don't know, does that sound okay? I mean, we could do it at the table since you don't know how to do the technique yet, but it might be okay just to start playing so I can watch people's postures and stuff like that. So we'll do liver 8 and kidney 10, practice gen and fu, and then we'll come back, depending on how far we're along, take a break. Well, I don't know if we need to take. Then I think what I'll do, the way I wanted to do it, I wanted to get in a little bit of a talk about pulse today and a little bit of talk about show. I don't know if I'm trying to, I wanted to get all 4 things in. What I might do, if we can do this in 45 minutes or an hour, find these points and practice gen and fu, then maybe around 3:15, I could do a quick lecture on pulse and show together, and then the last hour, then take a little break or something, and then the last hour, practice. Just practice feeling the pulse, finding the show, and practice doing a simple Ho technique. Does that sound okay? Okay. Tendons coming back at, you know, along the crease here, and you feel these 2 tendons right here coming together right into here, and this is kind of the location of kidney 10. What I think, I used to be confused about this, these 2 big tendons. It's like these 2 tendons are about the same size. What they're meaning is they're talking about this muscle in here.
All right.
See, this is the small tendon and this is the big tendon. That's what I think, because the way to find this, there's several different ways to find this point, but the most easy, one of the ways is to get your index finger on the semimembranosus and tendinosus, and especially the more medial one, you know, this way. So you're kind of pinching, you hook the index into there, and then with the thumb come off, like you can either take a line from the top of it or the middle. I've heard it both ways, so they're both pretty close, along to where the, kind of open up the knee, where the bone comes, right at the joint there. And kind of, and you kind of get a grasp like that around the tendon. This point is essentially kidney 10, and this point is essentially liver 8, is what they're saying. Another way to look at it, see, I'm not low enough. Wait a second here. I'm not doing a good, yeah, I was a little too high, okay. So it's this and this, so it's like kind of off here, kind of coming off the joint, off the bone, like so liver 8 would be about there, so you kind of squeezing them and you get a little pincer grip and get them both. Another way to look at finding liver 8 would be to close this completely. See, now this is not showing, and come up to the end of the crease, and at the end of the crease is liver 8. That's showing a little bit different location, but it gets you in, again, it gets you in the ballpark of where you want to be. So if you're opening, coming up to the end of the crease, so now you're looking in this area and you're feeling for liver 8 along the liver channel. 4, 5, 6, 7, 8. See, that still is kind of right where the joint is. So you can just play with people's legs sometimes is a way to do it. Open it up, and there's the bones are separating right in there. That joint right there is where the bones are separating, and that's where from that point, grab the tendon like that, and that's about where you find it along the path of the channel. And kidney 10 tends to be a little bit medial. It tends to be on top of this medial tendon. It doesn't tend to be so much between the two tendons. Right when the two tendons kind of come together, especially when you feel for the live point, it tends to be a little bit this way. More on top of this tendon is where you'll find it most of the time.
Would you show what body position you use to needle that? Especially on a man.
Well,
That is it, that toe point.
it's tricky. It depends on whether you're doing, left leg or right leg, and whether you're left-handed or right-handed.
If you're right-handed and on the left
yeah,
leg.
This is easy for me because I'm left-handed, see? And so, and if I want to tonify, I just simply, so if you're right-handed, so it's,
So I'll have you
it's
do
a
this
problem
side.
for me because if you see a lot more women in your clinic and you're left-handed,
Yeah.
then it's a hassle. But righties, most of you, can go with the flow really easy for tonification technique. It's just that when you get a man, then you have to decide. I mean, I probably fudge. In my clinic, what I do, just because I'm lazy and I'm getting better enough that I can get away with it, is I'll often, like I'll find the point. See, sometimes I'll just kind of follow the crease up, and just find that, so it's that crosshatch from the crease and the liver channel. It's another way to look at it. So there's several different ways you can conceptualize it. That, I'll come across, and I can already feel the indentation right there. It's right in there. See, that's kind of soft and soggy right there. Is a good, that might be a reasonable place. But see, and I'll just come like this, because I can get kind of but probably smarter if you're having to needle the opposite side would be that once you lay down,
Is going.
would be to
leaning
have
across.
have the person make people move.
Okay.
It's I don't like to make people move, but I've started doing it more. I mean, sometimes I'll even get. I mean, if it's awkward, this is a low table for me. I'll get down and then I can do it. See. Or if you want to do it official, I mean, you never see the teacher. You never see the teachers doing that, I don't think, but probably. But it's a little bit hard because you got to get. It'd be nicer if I had the table like this. So that's the other thing. Play with your table height, too. I'm thinking of buying one of those, ones that move up and down.
I like one
Yeah.
a hospital bed actually. 'Cause
Yeah.
Then you can put really wide people.
Pin white people on, yeah.
Wide. Well,
But so, don't be afraid to move. I mean, if you need to get them in some other position and it feels like you need to get it like this, okay, you can see. Get it like that. And well, I'm going against the flow there, so, I mean, what am I talking here? But
If you were coming from this
if
side.
if I was coming from that side, if I was coming from this side, you can do that. You can do something like this, so you can get with the flow. See, learn to just start learning how, and do it in a way. So this is not bad for me because I can have my hara right in there. Look at so, and I'm not doing my usual, my hunch, which you all will do. I guarantee you. So you can. So it's a nice. I've been pretty. I feel like I could really relax into needling the point that way. So that's one way to do the opposite side.
When you do kidney 10, do you have your leg a little bit more straight?
Huh?
When you do kidney 10, do you straighten your leg a little bit so you don't
Yeah,
have that crease to
I
deal
don't.
with on
Yeah,
your
see,
day?
if it gets too, it's a little bit harder. People have different kidney 10s. Some people, have a lot of buildup there, and it's really hard to get in.
And have a light Oshide off the skin.
Right, and you can't, it's in the way, so you don't even feel like you're making the contact with the Oshide so well. So you just have to play with it, And when you open it like this, you kind of lose the tendons a little bit. Depends on how you find it. So you find it, and then you can actually see he's pretty puffy and kind of weak right there. So then you can do it that way. But the most important thing is to find the posture. Don't kind of go like this stuff. You're not going to get any change. You're going to make the pulse worse, almost for sure. You just keep on coming back to, being in the hara. Try not to get too caught. I mean, if you get caught up with your eyes a little bit, that's okay as long as you correct. So if you're kind of going, trying to use your visual a little bit as well as your touch, then correct. Don't kind of. What you don't want to do is do something where you're like this. They'll always catch you. The teachers, they're at the hand and they can tell when you're hunching and they can't see. It's pretty amazing. So yeah, you have to find ways to get your body close into the table. And whenever you start needling, also it's just always think of a little space right in the axillary. You don't have to kind of do some fancy thing, but just kind of be soft through there, and then soft through the elbow, and soft through the wrist. Just try, and it's almost like the elbows kind of. To me, what works for me is almost like my elbows just are kind of softening and floating up, almost like a qigong idea, like where you just and then you can have reasonable posture, and then the chi's moving. Then when the chi's moving through you, and if you're also being technically correct, then you'll have a much better chance of succeeding. Let's just play with that. Those two ways to kind of find that bone coming from kidney 10, from the top of the kneecap. So that's a pretty good line too. So by all measures, you're in the ballpark, which is a good start. So, and then you're coming off. And then I would look in this general area. There it is.
Okay. Trying to hit.
So I'm saying.
I think where I'm hitting is, where I hit it was real close to this one. I hit it right there, so they're all pretty close. That was where I was guessing. We could check and see which one gets the best pulse change if you want to do that.
Yeah, let's do that. Yeah.
Do you have a pen?
I think that's yours.
Can I be on the bus?
Did you model a cat ball?
No, I'm losing it.
Yeah.
For her summer camp. Toyohari summer camp. Isn't that what you do at Toyohari summer camp? Stand around and do this outside.
Is it, you go to
Drink
Japan
green
for
tea.
2 days? A week?
Oh, no, you don't go for 2 days. Yeah, you mean the kids,
Japan.
the big thing this
Yeah.
summer, the 40th anniversary thing, when they go, they're having a big one-day celebration, and then they're having a 2-day workshop, and then they're going to offer a 3rd day just for the foreign people, for the Americans. So there's 4 days, and probably about for 3 days before, you'll be able to go around and visit senior teachers' clinics and get treatments from them and watch them treat it. You know, they usually kind of clear out their clinic for 2 or 3 or 4 hours, and you know, a herd of like we went in groups of like 6 or 7 of us, because we only had 13 people on the trip 2 years ago, and so that was nice. I think this time it might be a lot bigger. They might be. Ask Marty what he does again, because he here find the point that you want, roll off, find and just rest it just a hair above, just or almost touching, form the oshide.
Okay.
But then you got to change the angle so it's more vertical.
Well, you can make it perpendicular. Yeah, it's almost perpendicular is fine.
And if you're
But
on the
we are
point,
just finding out whether it's the right point, right?
Right, and that's what you do to find. Then you can check. So
Does it work if you don't do the oshide, or just not, or does it leak chi?
you might leak chi a little bit. It's best.
Okay.
It's better. It's better on the person's body to not. You know, you're not trying to do a big tonification technique. You're just trying to kind of do a neutral technique, just to very temporarily push the pulse in the right direction, assuming it's the right point and you're being soft at the skin. You just push the pulse in the right direction briefly. It'll revert pretty much within a few seconds after you get off.
If you're trying, like initially now when we're like practicing on people by ourselves, how do you do it? Do you try to find the live point and then take the pulse?
If you're doing it by yourself,
yeah.
it's hard.
Yeah.
It's really
Or
troublesome.
do you just like find it with your finger?
I just find it with my finger. I just find dealing with the teishin in my practice is just very time consuming. I don't have time to mess around with that.
Okay.
So
And the finger, do you think you wouldn't leak chi if you were just doing like
if
this
you're just
stroke?
touching,
You're just touching, trying to find the live point.
Yeah.
It feels good.
Or,
Then.
and some people even, if you want to get more cosmic, and this is not official Toyohari, but some people kind of
just like around
do
it.
some sort of, like a vase, like a noje technique, or or cranial, so if you can just tune, I don't know, touch it and feel if the cranial rhythm opens up a little bit. I mean, but probably for our purposes, since we're working with the chi system at the skin, this is, for Toyohari that we want to mostly work right at that, right at that surface chi level. So you can just do that and feel if it changes. Okay, this is like I think this is a 1 stainless. So what you want to do is you start it up, you form your oshide just like anything else, but you really want to be connected with the, because when it goes in a couple millimeters, you don't want to poke the person, so you want to really have a good solid oshide so that you're not stinging the person. You can actually push into these points without hurting people. You feel that needle a little bit there?
I don't feel it at all.
Isn't it? Yeah, one, and then you still go up and down 5.
So press the skin with the needle.
See, and the needle's touching.
Now I feel that.
There it is. It's not too stingy at all, is it?
It's stinging on my right side?
Alright,
It's kind of hard to concentrate.
One at a time. Let me do it. So, okay, now I'm contacting, I'm going in. Okay, now I've got the chi. Okay, so I tighten it and then I'm just up, down, up, down, up, down, up, down. Okay, it's releasing.
take a whole breath. Take a whole breath.
Could you show us again?
Again. Okay, again.
While you do it,
You know, again, this is a little bit slower advance. I mean, quick advance still.
Neither are we.
Okay, now into the chi. Make sure my posture's halfway right. Okay, I've got the chi up, down, slow.
Otherwise, you wouldn't use it. You'd spread the hell out of when you
Okay, it's loose. Assume it's loosening up.
Oh, you really push down hard.
Squeeze it out. Squeeze out.
And you pull it out slowly.
So that was Genjutsu.
That's Genjutsu. She was saying it's hurting, so I was trying to find out where it really was.
So for excess points, it's okay.
Yeah, it's excess points. It's okay to push in there. Yeah, if you're not.
Okay.
Yeah.
And then
Which finger, the middle finger?
Yeah, it's the middle finger.
So it's
Feel that
almost
right
LI10
there.
almost.
It's an LI10. It's a variation of LI10. Yeah. You could call it LI10. It's getting over onto the triple burner channel a little bit, but oftentimes you find these points right between triple burner and LI10.
Oh, there's a special point for that.
Triple intestine 10.
Yeah, that's Kiko. That's actually through a lot of different Japanese systems. It's not just from Kiko's teacher. A lot of different people use that area, and they all have their own special way of finding it. And in fact, people give it their own name. It's like the so-so's point, and it's basically the same as triple intestine 10. It's kind of funny.
I don't know, it's the Morgan point.
Yeah,
Is it right around there?
Okay.
that one might be. Actually, it had two. This one's just.
So can you say all the steps you're doing?
Okay, I'm advancing the needle.
No, I know, but I mean.
Are you pressing on the Oshide at all?
A little bit, yes. I'm not very stable. Okay.
I got it.
Feel it now? Okay, now it's into the chi. Actually, again, isn't exactly the technique I would do on this point. And I'm going to start coming in, out.
There it is, actually. Push it more like this.
Is that okay? Feel the chi a little bit?
I think in real life.
Can you feel it?
You're doing the jujitsu, right?
Does it feel like you're waiting for the resistance to go away?
Yeah. There's, it's starting to relax.
So it's kind of like a muscle.
So you're not on the skin at this point?
I'm pushing, the needle. You feel the needle a little bit? Yeah, the needle's
Oh,
touching.
you still are. Oh, you had just pulled back a tiny bit.
I'm making enough movement, but I'm not disconnecting. That's the trick: is to come up, but don't disconnect from the point. You know, you come up a little bit, and then you go back in. And it's like you're working. It's like you're caught in a little spider web or a little gummy area, and you're kind of just slowly coming up, coming down, coming up, because slowly working it. Like you might work if you inserted a needle into a point and you were just slightly going up and down. You feel the chi, the catch, and you're going to. And then all of a sudden you feel like the chi spread, the release. Is you're doing similar with this. It's just at a much more subtle level in the sense because you're working at the surface of the skin rather than neuromuscularly in the muscle. Now I've ruined the technique. I lost my focus there. Sorry. It's okay. That's not too bad. It's okay, isn't it?
Because it'll still disperse anyway.
Okay. Down, up, down, up.
That's strong.
So push down and come out slowly. See, so it's like finished it, finish the technique, squeeze out. This is the blood level genjutsu and come out slowly. Whereas if I were to quickly do the fujitsu, go down. So make sure that oshide is really flat so that when you touch the skin you don't sting it. You can actually indent 2 or 3, indent in and let the needle suck into the point. There it is. There's it. So, and then I'm coming up, down, up, down, up, down, up, down, up.
Oh, you think everything about me is
So
And that's
Fujitsu
food.
is much faster.
So Fujitsu is coming out fast and just
Fujitsu is the floating
key
pulse?
floating pulse. Fu is
Cold
key
heat.
level, yang level, floating pulse. Gun is
Yin,
blood level, yin level, blood level, sinking pulse. I mean, it's really clear. Chi level, blood level.
Can you say again what you were saying about the Oshide, that it's pressed in so that...
I don't know how to describe it. It's just, this is my sense. No one's described it to me, and I watched the teachers do it for years. My sense, so you get in, and when, I hope this doesn't hurt, I'm gonna indent. So say it's cutting into the skin a little bit, pushing into the skin. You're wanting a good, stable, you want to be stable here, and you want a good bottom right here. You see what I'm saying? Where the needle is going through the skin, because if you have a really good bottom there, then you can actually, if you're skillful, you can actually push into the point 2 or 3 millimeters and hook into chi by pressing the skin without stinging them. I mean, it becomes just part of the process. Or am I making? I don't know if I'm making any sense. It's just, you're just really I'm really controlling it. I'm pushing into the skin, but generally it's not stinging too much, right? When I'm not screwing around with it here too much. But
Is the Oshide then this?
whereas if I'm just kind of casual and loose with my Oshide, you go in and you touch and bam, it feels different. See, it starts to be more just a nervy, the little nervies at the surface of the skin kind of sensation. If you just have good control and are really focused and relaxed, and good control.
I'm not exactly sure what. Maybe this is too picky, but. I mean, is it your key that's helping it not sting?
My
or is there
intention.
some actual contact
It's both.
that's different?
It's both. It's both.
It's
It's just I'm controlling it. I'm feeling what's happening right at the tip of the needle. I know that the needle's now touching the skin. I know exactly I know exactly what's going on. Okay, now I know that the needle is indenting the skin, so I'm keeping it really kind of tight and really kind of firm here, so that the needle can dent the skin, and that I'm going in a way that it's not going to hurt her, and that way I can work with that deeper chi a little bit below the skin level.
But you can't really
and it's my intention.
You can't really say exactly what it is that's keeping it from hurting. It's more like just being completely
Just my
aware of
feel,
it.
my ability to control the chi.
Yeah.
That I'm able to control chi.
Yeah.
And I'm able to form the Oshide correctly, and that, I mean, and by I don't know what you're saying. I mean, I'm doing the technique well, that you can actually push a needle into a person into the skin level without stinging them, because you're just able to feel what's happening and control it.
I was just wondering if there's something physically different that's going on.
No, it's just having a good sense of advancing the needle, have a good sense of controlling the Oshide.
Okay.
The pressure of your Oshide on her skin is always the same no matter what technique you're using?
Well, that's not totally true. With some of the dispersion techniques, it's okay to be a little bit heavy, since you're going to be dispersing anyway. Never with tonification technique, but with dispersion techniques, you can be. My sense is, from what the teachers have said, is that you can be a little more compactful, a little bit rested, a little bit heavier. Yeah, you don't have to worry quite as much about that issue. But you're certainly not going way down.
So you're almost the same. And if you were the same, it would not be incorrect.
If I were the same as...
If the pressure of
was
the
just like,
Oshide
no, it
on
would
the
not
skin-
be incorrect, no.
Okay.
But sometimes, maybe pushing down a little bit can help you control, just very little though, help you control as you insert it 1 or 2 or 3 millimeters. You have a more appealing fine. Yes. Okay, we're a little bit behind, but that's okay. We're going to have plenty of time tomorrow, because I kind of scheduled more kike than we probably need. I think we can do most of the kike by 12:30 tomorrow. So we'll have most of the afternoon to play with other stuff. So, with people, I want to talk a little bit this weekend about pulse diagnosis and a little bit about show and practice. We just have a little bit less than an hour. Are people wanting to sit and listen for a little bit, or do you want to practice any more today? Listen a little bit. Make me work. I didn't word that right. Okay. I got a few more minutes left in me. I'm not used to talking this much. My throat is sore.
We'll practice.
Okay, these are gonna be short and sweet. So I'm just gonna kind of read through some notes here. And again, you probably had this already a little bit the first couple times. Hopefully I can help you flesh it out a little bit more. And we can kind of play, let me talk a little bit, and we can play with questions and answers, and maybe your questions will help me think of what I want to say. Actually, I'm going to talk about this today, but this pulse diagnosis actually is best done by practice. But I will talk about it, and then we'll practice it some tomorrow. So you know, pulse diagnosis is kind of a principal thing in meridian therapy here. You know, we talk about the primary show. We have the 4 diagnoses: looking, listening and smelling, asking, and touching. And touching includes touching the channels, and abdominal diagnosis, and then finally pulse diagnosis. And sort of the way we do it is pulse diagnosis is sort of the last step that kind of pulls it all together, but you need to do all the other diagnoses. So it's a weird thing where sometimes Acupuncturist is called pulse diagnosis therapy actually, but you need to have all the other pieces. You can't just lean on the pulse diagnosis, and I think other people have emphasized that. Okay, let me just go over this again. There's 2 aspects to pulse diagnosis. There's the 6-position pulse, and there's the pulse quality. And we've already gone over pulse quality: deficient and excess, slow, fast, sunken, and floating. These are the 3 things that you should look for in any kind. You know, the minute you start feeling the pulse, this is what you should do first, is feel for the pulse quality. The pulse quality, and like I said before, it sort of reflects, the pulse quality reflects the overall condition of the person. And through listening to the pulse quality is the basis by which we choose which techniques to use. And you know, whether we're going to needle deep, you know, whether we're going to tonify or disperse, whether we're going to stay on the point a little bit longer or stay on the point a shorter time, whether we're going to needle more deeply or needle more superficially. Is that clear? And it also helps. It also helps us choose the needles to some degrees. I didn't have this all written out, so I had to think before I, you know. Well, obviously, deficiency. We're going to use silver for a straight deficiency, maybe number 1 or number 2. With excess, depending on if it's like the ones we're learning next time, Koken and Jin, you can use like a silver, maybe a silver number 2 or something. If you get up to Fujitsu, which is excess at the chi level, you might use a silver number 2 or number 3, or maybe a stainless number 1 or something like that. If you get up to Genjutsu, you're going to use stainless. Stainless number 2 through 5, or even higher if you have this incredible pulse. So there's sort of a continuum of the techniques. You're kind of moving from from silver to stainless and from thin to thick, in a sense, based on the excess and deficiency. So that's one thing that you will be able, that you will be able to start judging what sort of needles you are wanting to use, and that's mostly where you choose it. It's not so much from slow, fast, or sinking, floating. Then, And then the second part of the diagnosis is the sixth position, and we all know the six, the six positions. What do they call it in Japanese acupuncture? They're called the Sun, the Kan, and the Shaku positions. And you have basically a long spleen, pericardium, or what we call, or the Ming Man. This is the yin aspect, and obviously their corresponding yang channels, and they call this the heart, obviously, and whatever else there is, liver, kidney. And you don't use the Ming Men in the sixth position, like I was saying this morning. It's this sort of Ming Men, or what we might call kidney yang position, is used more to kind of assess the overall quality of the source chi in the body, and is not used for the show. Okay, well, I'm going to walk through just, I'm going to talk, is it okay if I just talk about how I go through the pulse diagnosis one more time here? Just to make sure everybody, okay. So you place your finger on, there's the styloid process at the wrist. The middle finger goes at the styloid process. So the middle finger right over the middle, it comes right over the middle of the styloid process onto the artery, the radial artery, and then the other 2 points just naturally rest there. The backhand you can either do, they recommend you do with the thumb generally. I don't always, I kind of do it this way sometimes. I do it kind of both, so I'm not consistent. Thumb right around triple burner 4 area, or just kind of rest if that's, depending on the situation. So that's how they recommend that you find it. But you start with the middle finger. You don't just go on it. You really make sure you get the middle finger at the styloid, and then let the other 2 rest side by side. This is considered by far the best way. And just what I said that I don't always do, because sometimes I have a tendency to go like this, and sometimes I go like this, depending on what position I'm in or whatever. It is best to standardize how you take the pulse. If you find one way that's most comfortable for you, do it that way every time. You'll probably develop a lot quicker your abilities. So, as you sink your fingers into the pulse, so you found this, you start to sink your fingers down. What you're looking for initially is where the pulse is felt the clearest. It's what we call the middle pulse. That concept was introduced to you, right? The middle pulse. And the middle pulse may be at different levels. I mean, it may be, the lung pulse may be really it may be superficial in the first position, a little bit deeper in the second position, and really deep in the third position. So sometimes you may not be, it's a little awkward, but you may feel those pulses, they all won't necessarily be at the same depth on the same side, so you may have to make a little adjustment. And you're feeling for that pulse. That middle pulse, that's the middle pulse, and that is said to reflect the stomach, the general stomach chi in the body. The whole middle burner chi, the middle pulse. Then, at that point, once you find the middle pulse, you should then check for the yin level first. So we're checking, anytime with 6th position pulse diagnosis, again, we're looking for the flow of qi and blood in the channels. And that's what we're evaluating the relative strength in these 12 channels. So we're going down, and what we're trying to do at this point is evaluate which is the weakest flow of the yin channels. So then you can go down and feel down towards the bone. Now, you should go down gradually. Don't go way too hard at first. I mean, sometimes once you get more comfortable, you can sometimes go all the way and occlude it or something. But go down pretty smoothly, And don't obstruct it, don't press too hard initially. Just kind of work your way down and feeling for which pulses are disappearing or not. So, where do I put the chalk? So say you're going down into the yin level. Say you have a pulse here, a middle pulse, and here's the bone, here's the skin. And say it's a pulse that, you know, I don't know, it's kind of like this and like this. It feels like this. You're pressing down. Actually, I don't want to do it that way. Let's just not worry about it. You're pressing down, and as you go down, you're feeling for which pulse is disappearing first. And that will tend to be your weaker pulse. Like if you push, and this pulse disappears at this level, but this pulse and this pulse don't disappear until you're closer to the bone, then that is saying that this pulse is weaker than the other pulses. And then once you get down to a certain level and you start to let the pulse come back, your fingers come back up, this pulse will reappear, this pulse will reappear, and this pulse will reappear afterwards. So you can feel it both ways. So you can, and that's one way you can start to test which pulse is the weakest. And then you come up, after that you come back up to the middle pulse, and you do a similar process with the yang level. You go up, and which in this case, so how would it work? If this pulse appears here, and this pulse appears here, and this pulse appears here, then you would say, is that right? Am I losing it here? This pulse is the weakest pulse, because these are stronger than this. And vice versa. This pulse, you'll feel this pulse first, and these pulses are deeper, so this would be the weakest yang pulse. But that's just one way you can start to evaluate just in general between yin and yang. What in actuality, most of us cannot tell which are the weakest pulse by feeling them all at once. So we do this sort of two-position pulse diagnosis where we start to compare and contrast. So say you have these pulses again, lung, spleen, pericardium, heart, liver, kidney. What we do after we get the pulse quality, and you can, like I said, you can do just what I said. You can also go down to the yin level and check the general yin level with all of them, and come up and check the yang level with all of them. And that will give you some information maybe. But then you start to break it down. You compare. You feel down on the heart and lung and feel which one is the weakest pulse. You feel down on this one. You feel down on this one. You start to compare. And then you can also compare that way. So there's like 5 different comparisons. Especially, this one doesn't matter so much for the show, but if you do these 4 comparisons, you can, and you get accurate information from all of them, you will generally be able to figure out what, at least from what the pulse says, the primary show is. So heart, say heart is stronger than lung, and say lung is, liver is stronger than lung, which is the next one, and liver is stronger than spleen, and kidney is stronger than spleen. You know that this is a lung diagnosis. Do people follow that, right? Does anybody not follow that? The lung is weaker than the heart. The lung is also weaker than the liver. And the spleen is weaker than the liver, and the spleen is weaker than the lung. We know from our show, which I haven't talked about today, but you had the show last time, right? Do people understand what the 4 basic show are at this point or not? Does anybody not understand that? No. Huh?
Not really, I mean.
Not really.
You know,
We have 4 show in meridian therapy in Toyohari. Those 4, you know that. We don't do heart show. Heart. Part of Nanjing 69 is that with deficiency, treat the mother. So we decide, one of the ways we decide if it's a spleen, or, I mean, if it's a spleen deficiency, the mother of the spleen of earth is fire. So we tend to treat pericardium instead of heart. So we treat spleen and pericardium channel. Remember the, so if spleen is deficient, treat the mother as well as that. If the lung is deficient, you treat the lung and the spleen. If kidney is deficient, you treat the kidney and the lung. If liver is deficient, you treat the liver and the kidney. Is that, got
Yeah, I
that?
think part of it is just that I haven't had a lot of fibromyalgia and stuff. So
Yeah, all we're saying from Nanjing 69, and this is how the basic meridian therapists back in the 30s kind of interpreted it initially. It interpreted Nanjing 69. When deficient, tonify. When excess, disperse. With deficiency, tonify the mother. With dispersion, disperse the child. They've taken this principle and developed an entire therapy out of one chapter of the Nanjing, basically. And, I mean, they use a lot of other stuff too, but it's like the core of meridian therapy thinking. Let's see, where am I going with this? So all I'm saying is, so if you see this situation where clearly the lung is weak and the spleen is weak, you know by default that the pulse diagnosis is telling you, I mean, you may still have the abdominal diagnosis and the symptomatic diagnosis, and if you smell people, the smelling diagnosis or whatever, but basically in Toyohari they really focus on the pulse, the abdomen, and the symptoms are the 3 that and what I've seen end up with most weight. So you obviously have these 2, which is a lung deficiency. I don't know where I'm going with this. So is this? But I'm not sure if people fully understood this last time. I mean, is this totally new?
No, but we haven't.
It helps to have it explained a little bit.
Yeah.
Okay.
What?
Huh?
Does it help a lot?
It does.
Yeah.
Okay. So anyway, oh, I know where I was. So this. So I mean, this is a way that was suggested. It's in Shudo Denmei's book, Meridian Therapy. He talks about doing it this, but they do it in Toyohari too. But this, I mean, this, and you see the Toyohari teachers. If you look at him, if you look at Takahashi, I mean, he was going, you know, he these two. He was just kind of going all over, you know, checking any 2 pulses. So he's doing a kind of comparative process there, and this is the most pared down way to do it. If you can get a clear hit on those 4 comparisons, you know, you've got it. I'm sorry, did someone have a question? A couple questions.
I did. If you do that and it doesn't correlate to the 5 elements, mother, son, you know.
What do you mean?
Like, for example, you have lung weak and lung weak and liver weak.
Okay, if you have lung weak and liver weak really clearly, then they don't go together, although interestingly enough, they're on a control cycle. See, one of the things that's happening here when you go from here to here to here, and pay attention, is like, this is the control cycle. You compare heart, or compare heart and lung. You compare lung and liver. You compare liver and spleen. You compare spleen and kidney, and then you compare kidney and pericardium if you want. You see, you've got you're comparing things on the control cycle. But I just wanted to point that out. I'm not sure. I just want you to see where that's coming from. You have with meridian therapy, we're trying to come to a basic show diagnosis of 4 possibilities. We're trying to keep it really simple. We're trying to say there's basically 4 primal patterns in the universe, and we can branch out from there. I mean, there can be variations. There can be secondary show. There can be yang aspect. I mean, it can be built into a much more complex system if you want to. But you're going to decide one of those 4. So you have to make a fit, basically, is what they're saying. So you would then go back and listen very carefully. You think, okay, I know liver's real deficient and lung's real deficient, but these other ones don't feel so deficient to me. So what could it be? Well, it could be that if I listen really carefully, maybe the kidney's kind of deficient. So in which case, you know, I could have myself a liver show pattern. Or maybe actually, if I listen carefully, the spleen is actually more deficient than the liver, and therefore I would have a lung pattern. Do you see what I mean? You have to start playing with these things. If you don't get it clear, what you can do is something you can do do Chinetsky, do Moxa, or do a needling of the abdomen, do kidney, CV6, CV12, bilateral stomach 25 to clarify the pulse. That's one way. Because sometimes that'll shift things a little bit. Just add a little bit of chi to the system, and that sometimes clarifies the pulse. It might bring things up, and then you'll realize, after you do that, you realize, you know, I wasn't listening right. That spleen is really more deficient than the liver, so it is a lung diagnosis. So that's one way. But if you don't get totally clear, if you keep on coming back, stuck here, and just feeling like all these others are kind of excess, then you might move to the abdominal diagnosis. If you really feel like you can't get a clear hit on the pulse. Most of the time, you can eventually work out the pulse once you start to practice enough. But you could go to the abdomen and go to the lung area and the liver area and feel what's going on, and then something might jump out to you. Oh God, this liver area is just totally soggy. You know, there's no chi at all. You know, maybe I better listen. Maybe the kidney's really kind of deficient here. I'll go back and listen to the pulse, and then you find out, well, they have dysmenorrhea exacerbated by cold. They swam in lakes through their entire childhood, which would point to a deep kidney symptom more than a liver dysmenorrhea, say, for example. So you start tying it together and say, well, maybe, you know. Well, what am I saying? I'm going kidney. I mean, they have dysmenorrhea and it's a liver. I'm sorry, I'm going kidney. You figure out there's some other liver symptom, or they have some kind of pain in their, epigastrium or subcostal area. So you start looking at the symptom picture and start associating symptoms with channels. So you can be working along these 3 lines: this symptom line, this abdomen line, and this pulse line, and starting to weigh. And then you can go back. You can also clarify the pulse, and then you can go back. So there's a lot of flexibility in the system, but you are going to put it in to one of those 4 things somehow. This could end up, but I was getting off of it. This could end up being a kidney deficiency too, because the lung is pretty deficient. You may eventually, like I say, that was the other thing when I was saying about the kidney dysmenorrhea. There may be all these kidney symptoms, and you think, well, and then you listen to the kidney spleen and realize, well, the spleen's really not that much more deficient than the kidney, and when I listen to it, they're pretty close together, and the kidney is feeling kind of deficient. Maybe it's a kidney-lung pattern, and it's a kidney show, because all the symptoms are kidney, and you feel down in here in the kidney area, and it just feels hollow, or something like that. So it's a weighing process. It does, you know, and all the information may not always be perfect correspondence. Yes?
So if you were unsure of the show and then you just had to do treatment anyway, and you went ahead and did the kidney treatment,
Yes.
If you were right, even though I know Toyo Hara is sort of subtle and it's working on the root, would you expect the
Symptoms to change?
the patient would get a good result from that treatment? They would notice some change, or would you go more by just the pulse changing the treatment?
That's
You know,
a complicated question.
Because
Yeah.
I've heard sometimes people are unsure of the show, so they just
Yeah,
pick one
yeah,
and
you
try it.
eventually have to choose some. You can't just sit there and fret forever. You know, especially if you know, you're having another client coming in. You know,
Yeah, exactly.
You want to pick a show, any show. And you pick a show and you try, I mean, if you have enough time and wherewithal and interest, you pick a show, you needle the primary point, you go back to the pulse and say, well, that didn't change at all. So then you have to think, okay, did I just do a crummy job, or maybe this is not the show, or did I choose the point wrong? You know, is my point location wrong? Is my technique wrong, or is my show wrong? I mean, you know, you have to get to that point where you can actually start getting enough sense, you get enough experience that you start guessing, you know, guessing or intuiting or having some sort of sense of where this is where I messed up.
Then you have to ask, do I charge the patient?
Yeah, then you have
Especially commercials.
to. So, but no, it's an important question. I don't know what else to say about it right now. I don't know. Is that answering? I mean, do you have anything else to say about that right now? Yes?
I have a question. I guess I didn't realize that there wasn't a heart show. And so when I was in clinic, just working on diagnostics, feeling the pulse, I would come up with heart show a lot. So I'm wondering what you do when it is the weakest one.
Well, traditionally, they tend, if there's heart problems, they're most often going to be looking at spleen deficiency. You get spleen pericardium. What they actually do is they'll you know, if there's heart symptoms, they'll put that in the category of spleen deficiency, and then we check in the pulse and see if the pulse and the abdomen fit. But they'll be thinking more in those terms. And often, so they'll end up doing spleen 3 and pericardium 7 for the primary thing. You know, if you find that fits, or if there's a heart disease problem, actually, what they end up doing is spleen 3, heart 7. If there's an actual a problem with the heart muscle itself, or heart disease. But, yeah, that's that. But you know, and that's not hard fast. But that's generally the place that you'll be looking for spleen, seeing if there's a pattern for spleen deficiency. Yes. Oh.
Denmark's book explains it really well.
Yeah. Why don't you refresh me? I know.
Well, I mean, just that whole section on this, it just goes through it and explains it really well. And it's got the little diagrams on each show.
Oh yeah, yeah. Do people have them? I mean, Denmark's book is a good book to read, even though it's a different style of meridian therapy. It's the best book around. It's much better than our meridian therapy book, which was just kind of thrown together. Our meridian therapy book has a lot of good information in it, but it's, you know, once you get through these weekends, you'll be able to read this meridian therapy book better and better once you start to get more hang of things. But it's a hard book to read in some ways. It's just, you know, the way it's edited, and lots of, you know, all the points are in Japanese, and, you know, Ben Rishu's book is incredibly good. Did that answer your question though about, and you see what I'm saying? That there's a weighing process that has to go on, and like I say, it's these three are the main ones that I think that are the most important that I've seen them use. So it's incorrect. I mean, who was it? I was thinking in the dysmenorrhea problem. Someone here had a hot tub induced dysmenorrhea or something. You know, got frozen after a hot tub. Got dysmenorrhea. And when Takahashi last time came up to him, our table, he felt it and he says, they asked him, he says, dysmenorrhea, and felt the pulses and said, okay, liver show. And I was saying, well, we found it kidney. And he kind of looked at me, and then I explained that, well, this dysmenorrhea was caused by being in a hot tub, hopping out, getting too cold, and then had painful menses the next day, and then had painful menses 2 months afterwards. And then he says, then he felt again, he says, kidney show. So, see, I mean, and he's weighing, you know. It was a little bit of a toss-up, and when I explained the type of dysmenorrhea, he said that we were right, that the kidney show was fine. So, and I thought that was a good example of how, you know, other things can influence. You know, the pulse is really absolutely important, and yet you got to include everything. Okay. Yeah, if you've never read Nanjing 69, you should read it real soon. I mean, so much. Huh? Actually, I wish I brought Shudo's book. Do most people have Fukushima's book? You're supposed to get it for this thing. People do have it. Maybe tonight, if I have a few minutes, I will look through it and recommend a little bit of a reading list. If I have time before tomorrow at 5, I'll try to kind of distill out, you know, 20, 40, 60, 80 pages of it that you should read soon, you know, to start absorbing. You know, I don't know that. I mean, if you want to read through the whole book, that's even better. But maybe I'll try to come up with the stuff that might be most useful at this point. I can't promise I will get this done by 5 o'clock tomorrow. See, Nanjing 69, I mean, this is what I'm talking about, these lungs, but basically it says for lung deficiency, the basic pattern, now this doesn't always happen clinically, but this is the basic theoretical pattern, is that the heart and liver are excess, the spleen and lung are deficient, and the kidney is normal. And this is that's the basic pattern that happens, and then and it's laid out. Each one of them has their own pattern, and that's where they come up with this whole mother-child thing, you know, for lung deficiency in terms of choosing points. Let me just say, you know, the basic points, again, in case people, you need to memorize these right away. So that's spleen. This is lung. This is liver. And this is kidney. So that's why spleen is repeated there, spleen 3. You have to, you know, just know these 7 points upside down and backwards, because you'll be using them endlessly. Okay, I think that's enough for pulse in terms of talking. It's better to be practiced, and we will try to practice it some tomorrow. kind of covered selection of shoulder, but let me give one more. I've kind of been doing both show and pulse at the same time. I'm going to just give you a thing I have for clinical steps, just so you can have it right now. Basically, this is a simple flow of treatment. So I just want you to have it right now, so you can just start to get a sense of the overall structure, because I didn't get the sense of this overall structure very early on, and I think it helps maybe. Main complaint. So basically the symptoms that the person suffers the most from. And number 2, history and etiology. You know, what happened, when, cause, where it hurts, you know, the whole thing, how did it happen? So you start to gather, you start to gather stuff. Looking DX. The main things I think we've talked about especially are kind of colors or luster, you know, the quality of chi in the face and in the yin forearm. Like, have we shown how to stroke? You've already seen that, it's lightly stroking and looking, you know, maybe looking at colors and feeling for texture, feeling for chi, sogginess, hardness. Number 4, listening and smelling diagnosis. You can listen to the voice, smell the odors. I'm not very good at that. And then you get to the next one. So you're doing all of these before, essentially you're doing all these technically before you start touching. I mean, you may, as you get more efficient, you know, you may be doing everything at once in a busy practice, but this is the recommended line. You know, ask anything and everything, you know. What kind of treatments have they, what other modalities have they tried? Have they ever received acupuncture? What worked, what didn't? I think those kind of questions are really good. Find out what, you know, what worked and what didn't for them, what made it worse. You know, and all the usual, especially, you know, bowel movements, sleep, appetite, you know, find out all those menses, you know, anything like that. Find out about that, okay. And always check medical, get a reasonable medical history. Find out what's happened. And besides all the various diseases and, you know, what for. I always like to, one thing I really like to look for, being interested in structure, is, you know, accidents and scars and different things like that. If they've had something really, you know, really bonked themselves, find out about it. Find out where their body's stuck from an old traumas and where there's old scars. I mean, those are really easy things to approach, you know, in the symptomatic part of the treatment, where you can get results really good by starting to open up an old scar. It's things like that. But, you know, you all have your own ways of doing medical history. Okay, then you finally get to touching. So you check the channels. Now, Toyohari, they do it, they touch the channels, you know, you're feeling for chi, you're feeling for, you know, luster, you're feeling for what the condition of the skin is. You're getting this, you know, you can do it both, you can feel it below the knees and below the elbows, start to get a sense of what's happening at some of the 5 phase points. You can do a lot of that. They don't tend not to rely too much on that for the final diagnosis, from what I've seen. But I think you can get a lot of valuable information, and just keep on, you know, you can just get a lot of information from touching the channels, I think. And if you have other skills like, you know, cranial or something, you can just, you know, hold on to the feet and go, okay, I'm going to sense the liver channel. Sense the liver channel. Now I'm going to sense the kidney channel. Now I'm going to sense the spleen channel. I mean, you can start, you can, that's not Toyohari, but you can start to play with your other skills to start to get a sense of where things are happening. Then you go on to abdominal diagnosis. I'm not going to go. Everybody got Sachiko's email?
Yeah.
Huh? Okay. Yeah, abdominal diagnosis, which I think Marty is teaching next time. So I'm not going to go into that. But this is really, really an important part of the diagnosis. You're really looking for the pulse in the abdomen to correlate. If you can really get a clear correlation between the pulse and the abdomen, you're pretty sure you've got the show.
I'm not sure what email this was from Sachiko.
The
email address.
Zyncats
Sorry.
at AOL.com. If you want to order more stuff before next Saturday, do it. You have your little piece of paper with what you can order, and you should do it before next Saturday so you can get it by 4 weeks from today. Pulse diagnosis. So then you get the pulse diagnosis, and you do the two things, quality and sixth position. Both important to do both, not just sixth position. And we've had, a lot of us got a tendency to do sixth position and didn't do quality as much back when we were first starting. It wasn't made as clear, I think, or maybe we missed it. And from that, so now you've got it, and you choose the show, number 10 or whatever. You choose the treatment side, and you do the treatment. So that's a simple kind of way you can start to think in terms of order. I think it's good to have somewhat of, again, at the beginning, it's good to have somewhat of an order. You can skip, I mean, like listening and smelling, I mean, I just don't use it very much personally. And I don't use looking as much either. I mean, but you can go through, I mean, depending on your time and your interest of what abilities you want to develop, you can spend more or less time on different parts. So, but that's basically, I might talk a little bit more about show tomorrow too, but that's basically what I want you to know right now. Okay. Let me see. Just any other notes I want. Anything else I want to mention here? Okay, that's all I want to mention right now. So, I'm done. We've got 6 minutes for questions. Huh?
I think we got it.
Is that all, is that's clear?
Yeah.
What I'm saying?
It's very helpful. Thank you.
Good enough for today?
Yes.
Okay, tomorrow, we do 8 extra channels today, Kike. Again, pardon me, and organizing lectures is not my strength, but I think if I burble my way around here for the next half hour, and you guys ask questions, we'll get out all the information in a hopefully comprehensible fashion here. So, first of all, 8 extra channels. What do people know about 8 extra channels? I mean, I assume everybody's exposed to it in acupuncture school. I mean, is there anybody here that needs the basics? Or, yes?
What's interesting is all the acupuncture texts I read, they almost never say anything about them except for they're the reservoirs of chi, and there's a specific name, but they never really...
Yeah, I'm not going to go, I didn't prepare that part of the lecture. Steve Birch is really good at talking. I mean, read about it in his Extraordinary Vessels book. That's where I read about it in more detail. But yeah, but in the Chinese acupuncture doesn't, for the most part, deal. I mean, when I was in China, we almost never did 8. I can't remember if we did 8 extra channel treatments in any kind of form. I don't think it happened.
Like the most we'll say is like, do P16 for, because they have blood deficiency, because it's a sea of blood.
Right, and that's sort of using it, that's putting it into a little more Zang Fu sort of conceptual framework.
Okay.
So I'm not going to give you a lot you're not going to get a lot of theoretical stuff here. I'm going to give you a practical technique for dealing with pain. Because in the Toyohari Association, we're big into the root treatment. We're working with the 12 regular channels, and we're regulating the chi and blood in the 12 regular channels. So, how many people have been exposed to Monica's thinking and ion pumping cords? Most people? How many haven't? Just a couple? Okay. So, do a lot of you that have been exposed to it have used the ion pumping cord some? So, okay. So you have a little bit of an idea of, how a Japanese acupuncturist uses it. I mean, Toyohari uses it very differently than Monica. So we're just gonna go into it here. They're using it. Monica uses it more as kind of a root treatment, where he's balancing these different quadrants in the body. He sees it as sort of kind of a structural, energetic treatment. The Toyohari Association didn't start using.
It's the conch shell.
That's the conch.
Oh, we're already starting sound therapy. I got to get more tuned in here. Sorry. Okay.
It's the water element.
So, Toyohari started. Didn't even integrate. I mean, Toyohari, they're having their 40th anniversary this summer, and they didn't officially integrate. Well, it was 1972, so it was like over a decade. I mean, it's like 27 years ago. So they took them a while before they even integrated an official 8 extra channel treatment into their association. And 8 extra channels it's a messy topic. I'm gonna not go into it. It's a messy topic in the Toyohari Association because there's been controversy, and I don't know if people know the history here, how we all had Miyawaki Sensei come 3 or 4 years ago, and he's a Toyohari practitioner from Osaka, and he teaches a different style. I mean, he made it clear it wasn't Toyohari, even though he's a Toyohari practitioner. He's developed a whole system of abdominal diagnosis that he's tried to integrate into the Toyohari Association, and it's been researched some, but it's never been accepted. And so that's how we were all taught originally 4 years ago. We had been using abdominal diagnosis as really the main way to decide which pairs to use. But then we've gotten more exposed to the official Toyohari way, and over the last 2 or 3 years we've been told 2 or 3 different methods, so it's been very, very confusing, as to what is Toyohari 8 extra channel treatment. And what's coming out now in the last year or so is that it's very, very simple and pared down. They don't want to make it too fancy at all. They're using it basically as a symptomatic control thing for pain kinds of problems mostly, although you can broaden it past pain. I mean, you can broaden it into organ problems. I mean, if someone has a pain in their gut or something, or something like tension in their gut, a real clear congestion somewhere, you can use it. So it doesn't just have to be a specific pain in the channel, but they tend to use it mostly for pain problems. So everybody knows the 8 extra channel points. I'm not gonna go into that. I'm just gonna start describing the different aspects of what we do here. And I'm trying to think of what order I want to do it here. So, what we're going to do, do people mostly order their copper zinc pellets? Does everybody have copper zinc, or is there a couple of people that don't? You didn't order? We don't have any. So 4 or 5.
Can we use pennies and nickels?
No.
No. They do work.
You can borrow. Well, everybody doesn't need to have it today. I have a few extra if people want to buy 1 or 2. I have like about 11 sets here. They're $4 each. If people want to get a set or 2, the people that don't have it. But we won't need it. I mean, if you want to wait 2 until you order 2, that's fine, because we're going to be in groups of 2 or 3 or whatever. So whoever has a set will be enough. And we're only going to do one thing at a time. one set at a time. So I'm just going to start, like I said, I'm not totally organized. I just want to start putting out information, just general information about how we're going to do it. So, for one-sided treatment, so say you have a pain on one side of the body. I'm just going to tell you, oh, wait a second, no, that's a little bit too hard. Let's start with here. I'm going to start with treatment selection. So how we do treatment selection. Basically, we do treatment selection according to symptoms. So this is a symptom, like I said, a symptomatic approach here. We're just kind of trying to support the root treatment in some fashion. And basically, you look to symptoms that relate to the various, pairs of points, like P6, spleen 4, kidney 6, lung 7. And I will go, you have that in your handout, and we can talk about that. We'll talk about that in a minute, just go over that real quick. But basically, we're looking for symptoms that relate to these 4 extra channel pairs. And you also can look at channel symptoms. Now, channel symptoms, in Toyohara, Fukushima goes through it in his book, and I can't remember what page, but you should read that. I don't know that we need to read that today.
243 is odd meridian therapy.
That's the odd meridian therapy section, right? And they have the symptoms. That's where I basically got the handout. That's where I got the handout from. I just kind of took that out of that book. So you have that for the odd meridian. But what I'm talking now about is there's also 12 channel symptoms. So you can incorporate the 12 channel symptoms into your thinking. Large intestine channel pain or lung channel. You know what I'm talking about?
So you mean for Yin Wei, you look at pericardium.
So Yin Wei, yeah, for Yin Wei Chong, you might want to see what it says. If you look at pericardium and spleen channels and you see, say, oh, here it is on page 81. Symptoms of the 12 meridians. So this is Fukushima's hit on symptoms. Shudo Denmei has a really good, even more elaborate in some ways. Read Shudo Denmei's book about the 12 meridian symptoms, because he adds his own clinical experience quite a bit. And you get a little bit of a flavor how in Japanese acupuncture systems, they have a couple of different hits than you see in Chinese books about what the symptoms of the 12 channels are. It's kind of neat and interesting. You'll just see a couple things that you wouldn't expect that you maybe didn't see in your other books. Yeah, but like what I'm saying, you look at the spleen. I mean, it's pretty straightforward. Like, people have page 82 there? Like digestive organs, meridian governs the postnatal chi, lips, muscles, breast, heaviness of body, painful joints, quick fatigue, lack of appetite, weight loss, discomfort in the epigastrium, vomiting. Passing gas feels relieving. Those are typical spleen symptoms. And then here at the bottom, which is sort of answers one of our questions, I was going to mention that yesterday. Spleen meridian wraps around the heart and ends at the base of the tongue, so it's related to symptoms such as discomfort in the breast, epigastric pain. I think that ties it in with the spleen deficiency being, for heart symptoms. They like to use spleen because that close relationship between the spleen actually goes into the heart organ. And you also know on the Chinese clock, what is it? 9 to 11 is spleen. 11 to 1 is heart. So there's a real relationship between the spleen and the heart through that system too. So, anyway, so that's the other thing. You can look at channel symptoms. You can look at 8 extra pair symptoms to start treatment selection.
What do you mean when you say 8 extra pair? Do you mean like
the handout I gave you?
Yin Wei Chong Wei.
Yin Wei Chong Wei.
So it's just looking at symptoms of the channels, either the pericardium and
you can look at the pericardium and spleen channel, yeah,
or the Yin Wei
Chong Wei relationships, which are not totally unlike, but there's some differences. I mean, you can look at it from both ways. There's a lot of overlap there. Okay, so now if you have, if you don't know, if you're kind of feeling, well, it feels like it's on the large intestine, but it might be on the triple burner, or whatever, or this on the small intestine or the triple burner. So you have when you have multiple pairs of points, possible, you have to find some way to start to decide what are the best candidates for this. So what you should do at that point is start palpating treatment points and start figuring out what are the most reactive. Now there's this was part of the whole controversy or unclarity, maybe not controversy, but unclarity about how we do it in the Toyohari Association, because the way it was taught last time, especially by Yanagishita, is he's simply just kind of doing more the root level kind of touching. We were taught more pressure pain, and Monica style is more pressure pain to find the point, right? Yanagishita is just barely touching, and feeling for, there's the chi point, and then he'd feel the pulse. He'd put a copper tester on there, and then he'd feel the pulse. Oh, the pulse is better. That's the point I want to do. So the way I'm conceptualizing it is maybe there's like 3 levels. For beginners, use pressure pain. Kind of go in there. I mean, no, don't beat the heck out of the point, but go into small intestine 3, play around till you feel like, yeah, I got it. There's a little, there's a hang up there. I mean, to me, you could consider kind of an intermediate kind of style, which is that lighter Japanese, sort of in between touch. Rather than going down to the pressure pain, press in some, but feel for just slight discomfort or slight energetic weirdness, or you see what I'm saying? You can do it at that level, and that's good too. You can kind of just play it a little bit, but you're not just stroking the skin. You're actually pressing a little bit and feeling for. You can do it at that level, like slight pressure, feeling around, whatever. Something. I can show you too how I'm conceptualizing it. And then the last one is just stroke the skin, stroke lightly, like we're doing for root treatment. So it's harder. It will be harder to do this initially. I have a hard, since we learned about this a few months, in the last year that this is the way Yanagishita is doing it. I've played with it a little. I have a little bit harder time doing it. I can do it with pulse stuff now, but for some reason, kind of stroking the thing and then getting my copper thing and then pressing it and then checking the pulse, I'm having a harder time. Dan Ziz is really good at it. He's chosen to do it that way, and I think he's getting really good at that, but I have a harder time. So I still tend to rely on, feeling energetically. I don't always press really hard for pressure pain anymore, but I'm just kind of playing that point. That's where the energy is. So I guess I'm doing more of a, intermediate. And if I can't find it, I'll still go in deeper. And I play a little bit with, this way, because I obviously need to learn that more. But anyway, so that gives you, we're going to be starting. I think we should just do this and not worry about it, because we're just at the beginning. I mean, don't even have the root treatment down for, feeling pulse changes. We can play with it a little bit, but I'm not sure we should put all of our practice in it. I think we should try to practice with something a little bit more tangible today and see if we can get, hopefully some of us will have some aches and pains, and see if we can get some shifts in their aches and pains from, trying to get it right. Okay?
Do you try the discs on the points and then go back and see if the pain has improved?
Yes, there's several ways to do that. Like a lot of like Yanagishita has this little neat little gadget that has copper on one end and zinc on that. He just touches the copper in, and so they have copper zinc testers. Some of them they use magnetic testers. Although magnetic testers are suspect, that you never know what north. And some people say that there's confusing. So I don't know that. I think more of them are using copper zinc testers. You could even just get your, find your favorite object, like if you got a nice teishin you like, and just use the teishin lightly on the point. would be an okay. I mean, you know, I suppose you could even just lightly touch the point with your finger and see if it changes, you know, if you have a good energetic sense, you could, you know, so there's a wide range, but mostly they, and then the other option is just to put the disc, put the treatment disc on, and that's the way I usually, you know, just put the copper, we always use the copper disc on what they call the leading point or the master point, and the zinc on the couple point. So you put it on, you go back to the pulse, you see if the pulse changes. Now, this is another change. Well, basically what they're saying, I'm just going to say what they're saying these days, which is the pulse should change just like it does for root treatment. But with the proviso that it won't be as dramatic as root. It won't be as, how should I say, you know, maybe not as profound as a really, really good root treatment. So if it's, you know, so if the pulse is, you know, usually they say in Toyohari that the pulse sinks and becomes firmer. But that's not, obviously not always true, because if the pulse is really, really sunken, it should come up a little bit. But generally they tend to say that the pulse sinks and becomes firmer. But it should go in the proper direction. If the pulse is really undefined, it should consolidate and get better boundaries. If the pulse is way tight and wiry, it should maybe, you know, widen a little bit, but especially soften. If it's too fast, it should get slow. If it's too slow, it should get fast.
Would you get about the same result as we get with iron pumping cord? Just holding the...
Using this approach?
Is it about the same change you get in the pulse as if you would use the iron
I don't
pumping
know,
cord?
because I don't feel the pulse when I put the iron pumping cords on. I sometimes feel the cranial rhythm, but more often I just, you know, you know how you do the little finger thumb thing with iron pumping cords?
Yeah.
I just do that to kick it in, and I can always tell by the way my finger and thumbs feels that it's letting go, so I just kind of go with that. I can always tell to what degree I've done a good job. So I don't usually listen to the pulse.
The thumb is the guide, right?
Huh?
The thumb is the guide, is that right?
Okay. I don't want to get, let's stay on the, I'm sorry, I got off. It's my fault. Okay, now I gotta get it. So master couple here, help me get focused here. So anyway, so you got that. Basically, the pulse should move in the right direction, okay? And you can do, like, you can find your own tester. But you know, at this point, what I do is I just simply put the copper on, put the zinc on, and see if it's changing. Now, what you can do if you think there's 2 or 3 pairs possible is you can mark the points. You know, do your point location very carefully. Mark the points, and then go start testing one after another. Put one on real quick, test the pulse change, take it off. Put the next one on, test the pulse change, and see which one is the best pulse change, and then put that one back on.
Are you using this after root treatment or in place of root treatment?
Yeah, I was going to get to that in a
sorry.
minute. That's okay. That's an important thing. Let me finish with this part, and I think that's all I want to say about how we do the treatment selection at this point. Do you have any other questions about treatment selection that are not clear?
When you talk about moving the magnet, copper,
Yes.
you have zinc on at the same time, or just do the copper?
You can just try the copper. I mean, you'll start to get changes with the copper, but I think it's best to put the get the polarity. Yeah, I think it's better to get the whole polarity on there. I mean, I see, you know, you should just put the copper on and then check, but I think it's safer to put the whole polarity on it at a beginning level, just to see and to kind of hook it in and then see what the whole circuit is doing.
You could use gold and silver, can't you? Basically.
Yes, they do the gold. What is it? The gold and silver PM needles, the PM shin needles, the little. I forget what. I think you can get them from OMS, but they cost like 50 or 60 cents each. So you're spending like $1 something every time you do an extra channel treatment. They say that these PM shin, and I've never used them. Shin needles are the best, that you get the strongest effect, stronger than the copper zinc disc, but you know, they're expensive, I don't use them. Yes.
When you're putting the discs on the check, are you using left, right for male, female, or based on
No,
the size?
no, and I'll get to sided treatment here in a minute. So, your question again was, oh, root treatment. Let's talk about that, and then we'll go into then we'll go into sided treatment. Root treatment, basically, Steve Birch has talked about this when they were experimenting back in the early 90s with Koi Kurahara, and they were doing a lot. And what they discovered was if they did the root treatment and then did the Kike treatment, the pulse would get worse. It was like they ruined their root treatment. It was like somehow it was too strong and it would ruin it in some way. Usually it would worsen the pulse quality, but sometimes it would even worsen the whole 5-phase, the control cycle relationships. It would make the pulse, it would create yin-yang and 5-phase imbalances too, and not just make the pulse hard again, or usually unconsolidated. It would do it. It would make it more unconsolidated, especially if you left it on too long. So they just started doing it where they do the 8 extra channel treatment first, and work out the symptoms some. So this is an example where you would work on the symptom first before you do the root. And I think that's generally how I do it. I know Koi will do them both at the same time. He says you have to be careful though. You have to really know what you're doing. If you have the copper zinc on and you're also doing a root treatment, you really have to understand pulse diagnosis to do it correctly. So I'd probably recommend not doing that at this point. I think what I would recommend is you do copper. If you're going to do an 8 extra as part of the treatment, do copper zinc first and then move on to the root treatment. And that's by far the safest, because then you can, and I think sometimes what happens is the copper zinc will clarify the pulse sometimes too. You'll get a better sense of what's going on for the root treatment, because it'll get that 8 extra channel level. So, side of treatment. Okay, so if you have a clear one-sided treatment, you treat that side. Okay? But you don't have to. I mean, you can, again, this is where once you start getting comfortable with it, you can start trusting your sense of touch and your sense of how well the pulse changes. But generally, the cookbook way is one-sided treatment, treat copper and zinc, same side as symptom. So that's the basic way that they're suggesting. But you may put, like say you have a back pain and you put